Okay, then Elizabeth, I'm starting it now.
Good afternoon and welcome to this online event organized by the US Mission to the EU and the European Policy Center about the health response to the humanitarian crisis in Ukraine. My name is Elizabeth Kuiper and I'm the Associate Director and Head of the Social Europe and Wellbeing Program at the European Policy Center. This afternoon, we will discuss the health response to the humanitarian situation and especially the need for increased humanitarian support for Ukraine. And we have with us 5 impressive speakers that will share us their insights from their organizations, be it on the ground or working very closely with patient communities on the ground in Ukraine, as well as in communities within Europe. And last week, of course, we had a rather historic decision to grant Ukraine candidate status. And of course, while that is a very important historic step, the war has led to a grave humanitarian situation in Ukraine. It's now more than 4 months after the start of the war, and really the humanitarian situation across Ukraine, and particularly in the eastern Donbass, is extremely alarming, and it continues to deteriorate. If you, for example, read the latest situation report of the World Health Organization, there have been 295 attacks on healthcare. And that includes health facilities, transport, personnel, patients, supplies, and warehouses. And I'm sure that our speakers will elaborate more from their experience on the ground. So I really also welcome the audience and are looking forward to indeed an interactive conversation about what we can do more to contribute to the crisis in Ukraine. I think by now you are used to the practicalities of being in an online meeting. So if you have questions, please raise your hand or put your questions in the chat. I think an important practical remark also to mention is that we have our Ukrainian speaker that will speak in Ukrainian and will be interpreted to English. So I think it's important in your settings that you go to the click interpretation button and that you then choose the language that you would prefer to hear. And I believe then everything should be set to hear the interpretation. To set the scene, I would start with a video that Oksana Obertynska, our first speaker, shared with us. Oksana is a doctor working in the field. She will introduce what she does and how the field hospital has been set up. But I thought the video that she shared with me is very compelling. It really shows the incredible work of what's happening on the ground, but also really how alarming the situation is. I really would like to show it in advance, but with a little warning that the video contains graphic content that can be rather shocking. So please keep that in mind when we start watching the video. But I would like to do that now and then give the floor to Oksana.
Мене звати Арестович Антон, я лікар-ортопед-травматолог. І зараз спільно з загоном ПДМШ ми працюємо у Донецькій області.
Тут ПДМШ допомагає і має можливість допомагати на кількох напрямах. Це операційна. Велика частина команди працюють в операційній. Це хірурги, травматологи, анестезіологи, операційні сестри.
Погнали! В зв'язку з дуже великим напливом і кількістю важких постраждалих. В основному це мінно-вибухова травма, це хворі, які потребують специфічного лікування, первинної стабілізації. Це основне, чим ми тут займаємось на місцях роботи, наших стабілізаційних пунктах.
Далі далеке плече – це теж ми. Коли потрібно перевезти важкопораненого, у нас є кваліфіковані екіпажі на реанімобілі, які можуть довести такого пацієнта до лікарні, до Дніпра, до Києва або трошки ближче до Павлограда, де є можливості далі продовжити і відновлювати людину.
Це важкі хворі з важкою мінно-вибуховою травмою, травматичною ампутацією кінцівок, відкритими переломами, важкою крововтратою і такого роду травмою.
Інша частина команди працює на евакуації. Військові привозять поранених на певну точку, там підбирає екіпаж ПДМШ і везе в лікарню, де пацієнта стабілізують і далі везуть на велику землю доліковуватись після поранення.
Тому для нашої роботи ми на даний момент потребуємо в першу чергу апаратів зовнішньої фіксації, перев'язувального матеріалу, розчинів антисептиків, таких як бетадин, які ми можемо використовувати для обробки шкіри і раньових поверхонь. Ну і, звичайно, це наркотичні енергетики, такі як налбуфін, морфін, кетамін, засоби для наркозу.
So indeed, in terms of setting the scene, this video shows you the urgency and the gravity of the humanitarian situation, but also the incredible work that volunteers like Oksana are doing. So Oksana Obertynska, our first speaker, is the head of Ukraine, Native Ukraine, a hospital that is active on the field. And Oksana, we're very honored, and I would say even humbled, that you're with us, because you have a lot to deal with, and the fact that you're taking time to be with us today is very important for us. So I really would like to give you the floor to tell us a bit more about how the hospital that you're dealing with has been set up, because before the war you had life in a very different setting. So can you tell us a bit more about the role that your medical hospital, the field hospital, is playing, and how you're providing medical assistance to citizens, and also what are the main challenges that you deal with on a daily basis?
At first, in 2022, at the start, Ukraine and our citizens since this time have suffered from the aggression of the Russian Federation in our country. And we are witnessing hostilities of different levels of intensity. There are issues with information warfare, energy conflicts, trade conflicts, and this military aggression is accompanied by very significant loss of life, and is causing a huge damage to our state and to its citizens. The creation of mobile hospitals and mobile surgeries can help to any hospital to function in any situation. We can also create tent towns, tent camps in the place of hospitals that have been destroyed. And these field hospitals will provide primary and secondary medical assistance. When a field hospital is deployed, it only takes 40 minutes, and they can see 150 patients a day. A mobile hospital can be deployed even close to the front line and can be deployed within minutes and start offering essential medical help, and can help to stabilize the wounded, and can also help the civilian population, and also will help with their following evacuation to hospitals on the mainland. Many people were forced to move internally, and we have statistics that say that 12 million people have been forced to move. A number of them, around 5 million, are internally displaced, and about 6 million have left Ukraine altogether. Some people have moved to other regions of Ukraine. We will also need to try and provide medical assistance to them. Of course, this will affect healthcare in general in Ukraine. And today we can see attacks on various medical facilities. More than 90 attacks have been registered so far against medical facilities. This is unacceptable. This situation is a threat to doctors, nurses, various other personnel, and many people are scared of attending medical facilities. We are observing active facilities, and we can see that the focus of medical assistance is being shifted to wounds, trauma, fractures, etc. And we can see attacks on medical facilities. We can understand that we can provide less help to patients with non-communicative diseases. For example, we can give less attention to patients, to TB patients and other HIV patients, diabetes patients. But this healthcare needs to be provided. We need to support these people. So we need to make sure that this assistance is provided and is maintained at the same level today. I wanted to thank my colleagues, highly skilled specialists in the National Healthcare Institute, named after Dr. Shupko, that I belong to as well. And I'd like to thank all of my colleagues who, despite the risk to their lives, have joined this effort as volunteers from the very first days of the war and have created a mobile hospital, field hospital, together with the Native Ukraine Foundation, and are continuing to provide healthcare around the clock and are doing everything to make sure that medical assistance is provided even in bomb shelters. Coordination of this work and the use of damage control, work with the wounded during evacuation was a priority for our mobile hospital during bombardment of Bucha, Stomel, Irpin, Stoyanka, Pushcha, Voditsa, which are all of the towns that you have seen in the film. I wanted to thank my colleagues for being able to adapt to new conditions in wartime. They even continue their teaching efforts. They work with the next generation online. And it was very important because people had access to the internet, and we were able to even conduct or provide medical services, including labor, online. Our colleagues have demonstrated unprecedented courage, and many of them have suffered from the war themselves, but they continue to work in order to save other lives. Many have reoriented their focus and are now mainly dealing with the wounded. Unfortunately, we have a limited supply of medical equipment and medication. It will be exhausted at some point. In some regions, that's already the case. The longer the war lasts, the more problems there will be with supply of medication and medical equipment. Civil society organizations, charitable foundations work around the clock in order to supply all these things to the hospitals. Bandages, medications to the regions that have suffered the most, but unfortunately that's not enough. At the same time, we still have the issue of tactical medicine, battlefield medicine. We need to coordinate the actions between military healthcare and civilian care facilities. There's also a huge problem with rehabilitation. We we save people, but there are not enough rehabilitation centers. We're not able to provide this essential help to the wounded at the stage of their rehabilitation and to their families. In order to provide healthcare to the military and to the civilian population, we need humanitarian, financial, and other help from our European partners in order to be able to provide qualified, skilled assistance to our military and our civilian population. And today we're talking about the issue of security. There's no way around it. In many of our regions, there are still active hostilities, and we need filters in order to be able to purify water. Sometimes this water is taken from pools, from rivers or lakes, and it needs to be purified. There are all sorts of risks in these regions, and they're not encountered in other countries in normal circumstances. We have 400 kilometers of uncontrolled borderline where movement is extremely complicated, but our fighters are there, and very often we have problems caused by the fact that there are corpses in this area, there are rodents that spread infection, etc., etc. And sanitation service is not in control of these territories, as well as hygiene and sanitary services are not in control of these territories. The situation is threatening. It's very concerning. We have a risk of a number of diseases, including cholera. There have been notifications of cholera. In the DNR and LNR, there are many people, new people who are bringing various diseases with them, including venereal diseases. There is also a risk of prostitution spreading and other diseases that can be spread by the rodents in the occupied territories. A lot of territories are mined. It is also a priority because even a local emergence of these biological threats requires concerted action. Because these threats are not recognized either regional or state borders. Thank you very much.
Well, thank you so much.
I tried to cover all of the problems that we are facing. And I tried to mention the mobile hospitals. I tried to mention what happens across the country. And I wanted to explain the connection in the cooperation between military doctors and civilian doctors. And I wanted to cover the problems with which we need your help. We need help from Europe so that we can receive assistance in time. Thank you.
Well, thank you very much, Oksana, and also to the interpreter. I really would like to thank you to facilitate the conversation today, because indeed you set out very, very well the seriousness of the situation. And I think you touched on a lot of issues that we will discuss later, and especially your call at the end for Europe as well as for the US to continue to take action, also political action, but also practical action when it comes to military support, but also medical support. That is very well understood. And I think that is a very important outcome of today's discussion, that we need to keep that very high on the political and the agenda, really, also from all our communities involved. I have perhaps one question before we go on to the next speaker. Because I have read that 1 out of 4 people in Ukraine are over 60. And I was wondering, also given elderly people with disabilities, and also given the lack of workforce that you mentioned, how do you manage to reach these people, and especially in places where the infrastructure is heavily impacted?
People over 60 come to us themselves, and they are trying to provide help themselves. Some of them dig trenches, some of them wash the laundry, someone helps to take care after young fighters. They train. They tell people how to behave in particular situations. Of course, we don't forget them either. We try to help them. We try to help them with food, for example. Our charitable and civil organizations create headquarters, offices that will provide help to them, food for them, and shelter for them if they need it.
Well, thank you very much for that additional context, really, Oksana. And we will come back indeed to that question about what can we do more, both in the US as well in Europe, to ensure that indeed This remains an urgent call for action high on the agenda. And our next speaker is Fred Abrams from Human Rights Watch. Fred, you're the Associate Program Director for Human Rights Watch. And again, we're very happy that you're also able to join us today to tell a bit more about what are, for you, from your perspective, the organization that you work for, the main humanitarian concerns on the ground. And could you also say a bit more about how that relates to your longer term advocacy? Because we already mentioned the fact that, of course, this is so much a mix of, let's say, political will, political support, but also a lot of practical support. So the floor is yours, and we're looking forward to your contribution.
Okay, well, thank you for this invitation, and it's an honor to be with our colleagues today, especially those from Ukraine, who I know are working in incredibly difficult circumstances. So my respect to you all. I think, you know, everyone, you're probably familiar with Human Rights Watch's mandate. We're monitoring and documenting the violations of the laws of war by all parties to the conflict. The vast and overwhelming majority of those violations are from the Russian side. But of course, Ukraine is also obliged to respect those rules. I think maybe the most significant finding so far from our work is a wanton disregard, a brazen and callous disregard by Russian forces for the laws of war or international humanitarian law. And I would say that we're focusing a lot on two core principles of the law, humanitarian law, which is distinction and proportionality. And in brief, that, you know, armed forces can only target military objects and military personnel, legitimate targets. They may not target civilian objects or civilians themselves. And they must distinguish between the two. And proportionality is that, you know, the anticipated impact of your attacks, where the civilian toll cannot exceed the military toll, and you must always endeavor to reduce the civilian toll. And what we're finding now is just again and repeatedly clear patterns of this not taking place, right? And I want to highlight the numbers from the United Nations, which says, as of, I think, 5 days ago, approximately 5,000 civilians have been killed and approximately 5,000 have been wounded. And they clearly note this is an undercount. The number is most certainly higher. But what's very significant is a line in their updates. It says, most by use of explosive weapons with wide area impact, okay? Basically, that just means, you know, different types of weapons that have an impact, can injure and kill people over a large area, 100, 200, 300 meters. So we're talking about artillery shells, missiles, bombs, cluster munitions, and they should never be used in populated areas, in cities, or else other places where civilians are present. And we're seeing this just again and again and again. And civilians are paying a horrible, horrible price. And those who are wounded are suffering traumatic injuries from those explosive weapons. One example that we saw just yesterday and is in the news today is what happened at the shopping center in Kremenchuk. And I wanted to say we have some investigators who are in that town right now. And I spoke with them just before coming on this call. They've confirmed 18 people killed. Civilians, all of them apparently. We have the names of the wounded. So it's 18 dead, 36 people are still missing, and 57 people were wounded. 25 of them required hospitalization. And I saw statements today from the Russian Ministry of Defense that the mall was not hit. The mall was hit. The shopping center was hit directly. Our people saw that with their own eyes, and the mall was open. This was a functioning shopping mall at the time it was hit, which Russian forces should have known. I would just state, because it is a very important principle of IHL, both parties, that Ukraine is also obliged to, whenever possible, position its forces away from civilian areas. Now, it's not an absolute requirement because sometimes in urban combat, it's necessary, but they should always endeavor to stay away from populated areas, not deploy in schools or other facilities, civilian objects. And if they do, to encourage civilians to leave the area. And we have a few cases where that could have been done better, and we're speaking with the Ukrainians about that. But still, let me re-stress, even if Ukrainian forces deploy in a civilian object, that does not mean that Russian forces are then free to fire. It's not a green light. You still must respect the principles of distinction. I would call all of that abuses from a distance, right? It's, attacks from artillery or from afar. But the other type or category of abuses, violations we're seeing are from close, right? And that's areas of that were previously occupied around Kiev or around Chernihiv, where Russian forces held the area and then retreated. And the classic, the most egregious example, or the signature example, is Bucha. But there are many Buchas around those areas, and we still don't know, about other areas under occupied control, like Kherson. What we'll find. Well, Mariupol is another issue completely. We just don't know because of no access. But in these areas, we're talking about detentions, we're talking about torture, we're talking about some executions, and we're talking about some cases of sexual violence, which is a topic. Maybe we can discuss that in the question and answer. It's a delicate topic. It's difficult to investigate. At this stage, we have some cases. And it's a process to document those cases, and a challenge. So maybe we can discuss that. So I just wanted to close with a few things. I mean, these violations I mentioned all have a significant impact on people's physical health. That's obvious. But I wanted to stress also mental health, because, the trauma is deep. I believe it will be generational, because trauma gets passed on to children and grandchildren. The impact on children themselves is intense, and I hope that there is continued support for Ukrainian colleagues who are focused on mental health and will be for a long time to come, and that includes for refugees. Who may not have seen violence directly, but are suffering deeply from the displacement and the trauma of what's happening in their country. I'll just close by some of our recommendations or our policy asks, what to do about all of this. As an organization, one of our big objectives is to promote and demand justice. And that means at the International Criminal Court. It means in the country with the general prosecutor. It means domestic prosecutions in other countries. And a number of them have opened investigations. If it's Germany, where I'm sitting, if it's Lithuania, Poland, I believe Sweden, and a number of others have opened criminal investigations, which is another avenue to justice through universal jurisdiction. Our issue here is a concern about coordination. There are so many efforts and so much assistance is going to the Ukrainian general prosecutor that there can be a lot of crossed wires and stepping on toes. And we are speaking a lot within the European Union and the United States government and others that this assistance be coordinated. And that also for the victims. Right? We don't want victims to be re-traumatized, interviewed again and again and again. Speaking of mental health. So there's a need for a victim-centered approach to justice. And then, that's longer term. I mean, more concretely, there should be humanitarian aid. There should be aid for healthcare and healthcare workers in Ukraine and to support refugees who are abroad. I'm going to close by just highlighting a positive development in this horror story, which was earlier this month. There was a high-level diplomatic meeting in Geneva to finalize text about the explosive weapons in populated areas. And there's movement for a political declaration that will be hopefully signed in late September or early October, where states will pledge not to use these dangerous weapons in populated areas. And we're calling on governments around the world to join their named and sign this declaration, stigmatize, ban, forbid, and banish these weapons use from urban areas or where civilians can get harmed and killed. And then lastly, I'll stop here, is returning to the issue of justice, is a call and a demand for no impunity. You know, and if it comes to political negotiations to stop this conflict, that protection from prosecution for those responsible, including the most senior level commanders, not be on the table, and that accountability is essential for justice for the victims, for deterrence in other conflicts. And we will continue to lend our voice with our Ukrainian partners and friends to avoid that amnesty be part of any package in political negotiations to hopefully end this conflict. So thank you once again.
Well, thanks, Fred, also for bringing in that notion of justice and also what can be done legally, because clearly the point of departure for today's conversation is the health and humanitarian situation, but all these elements really come with it. And it's indeed an element that I'm very interested in, because you mentioned coordination. And I think that is perhaps something that we also might want to discuss later on, because our next speaker is Kim Feldewerth from the Halo Trust. So I am indeed also interested to hear also from your organizations how indeed you are working together in a highly impacted infrastructure, because especially in a point in time where the G7 is today coming together again, we will need coordination at a global level. And in that respect, I'm keen to give the floor to Kim, because Kim, you represent the Halo Trust. You are their policy manager for Europe. And I'm very keen to hear from you, from your perspective, from the Halo perspective, how have you been adapting your Ukraine program? Because you have a lot of experience on the ground as well. And what are the major difficulties in relation to the provision of humanitarian aid and specifically medical aid?
Perfect. Thank you very much. Thank you very much for having me, and thank you for all of the insights we've already heard. We certainly have a lot to discuss in the Q&A later. I will start with a brief introduction to the Halo Trust. We're the world's largest humanitarian mine clearance organization, operating in 28 countries and territories worldwide. Halo works at the intersection of humanitarian development and security needs to protect lives and restore livelihoods affected by conflict. Originally established, we were established in Afghanistan more than 30 years ago, and Afghanistan still remains our largest program. And now Halo works in conflict as well as post-conflict countries. Prior to the war, Halo has been present in Ukraine since 2015 and has been clearing in the Donbas region. Our key locations there were Kramatorsk and Mariupol. And prior to the 24th of February, our program consisted of 430 Ukrainian staff who were all working very hard to tackle the high levels of contamination by landmines, cluster munitions, and other remnants of war. Our team back then estimated that the clearance would take around 20 years. Late last year and early this year, the program has been monitoring the volatile situation, as safety of our staff is the highest priority and remains the highest priority. In February, the program was on stand down due to the weather conditions, and staff evacuation was key. The program monitors staff movement as much as possible and continues to do so now. So there are major difficulties in relation to the provision of humanitarian aid and specifically medical aid. Firstly, our existing presence prior to the 24th of February has enabled us to respond rapidly to the current humanitarian, but also especially the contamination crisis, and we've heard about that just now. Halo is and remains the largest humanitarian mine action operator in the country, and we are funded by the US, the EU, and other donor countries to deal with the level of contamination. As the program moved east from the east to Kiev, Halo diverted its resources to the wider humanitarian effort. Ambulance and trained medical staff are part of each Halo program. As part of our initial response, Halo staff delivered trauma kits, and the skilled doctors among our staff delivered the medical supplies Halo has in stock for mine-related accidents, which are and continue to be well suited for the context. This enabled us to provide the rapid first aid response, and we're currently providing a similar first aid rapid response in Afghanistan following the severe earthquake last week, where we were able to support rural communities within 24 hours due to our presence on the ground. So the trained first aiders distributed stocks in communities, and Halo teamed up with UK Med in the first few weeks of the war when Kramatorsk railway station was struck by a rocket. It was Halo deminers and medics who were also present to help look after the injured, as due to the high levels of movements among people, very few doctors are still in the area. So in these first few weeks where Halo could not clear any explosives, the situation was fast developing. Our staff on the ground used their medical knowledge and our resources to help out in communities. In parallel, we pushed our digital risk education messaging to warn people of the danger. And so far, 143 million impressions have been shared. So that's the amount of times our risk education messaging has appeared on people's social media feeds. Explosive ordnance risk education remains key due to the increased internal displacement and general lack of awareness of the risks of explosive remnants of war. And we've heard about this already with the returns of several million refugees and IDPs to their homes. We expect that there will be quite a sharp increase in accident figures. And now Halo teams are actually delivering both in-person risk education but also reaching communities continuously through digital messaging. Since the beginning, our researchers are tracking the conflict and incidents on social media using open source data. Across social and traditional media, there are vast amounts of information regarding the ongoing explosive remnants of war contamination. And this information is then used to advise and influence our risk education, our survey activities on the ground. It's informing our training and equipment needs. And so far, the team has logged over 11,000 individual incidents. So a quick note on what has Halo done to adapt the program and how we're scaling up to deal with the unprecedented levels of contamination and destruction. And obviously, as already has been heard, particularly infrastructure, including medical facilities, are vastly affected. So our mission is to protect lives and restore livelihoods of those affected by conflict. And in order to be able to deal with the contamination as efficiently as possible in the long term, the ongoing hazard mapping is crucial, and this has informed the scaling up of our UK program, and we're looking to expand the program to more than 2,000 staff next year. Considering the deteriorating situation in Donbass, in early April, Halo identified Voditsa as a safe location to reconvene staff, to evacuate equipment, and to set up temporary logistics and training in place. And since late April, we have the permissions to conduct survey and clearance activity in Kiev Oblast, which is heavily informed by the aforementioned tracking of open source data. In May, we also established a base in Brovary, northeast of Kiev city, and deployed our first survey and clearance team, who are doing an amazing work on the ground. Our accident data since 25th of February details 73 accidents, that's 64 killed and 83 injured. And the number is is expected to be vastly underestimated. But that's what our team has been able to verify. And it's also important to note there that we've seen an increasing impact in rural areas and on agricultural fields. And obviously that impacts food security greatly. As mentioned before, the level of explosive contamination is unprecedented. We are tracking the contamination on infrastructure and that's obviously including, as I said, hospitals and clinics. But it is important to note that a damaged hospital or clinic does not necessarily suggest that the surrounding area is contaminated. It depends on how the hospital was damaged. So, for example, if it was damaged by a cruise missile or an airdrop bomb, it is highly unlikely there will be any remnants of unexploded ordnance in the area. But if it was in the scene of heavy fighting between ground troops or within range of Russian artillery and it was shelled, then the likelihood is quite high. Our verified data outlines that the destroyed hospitals and medical facilities are affected. However, it is very important to consider, and I think Oksana, you touched on that before, it's also the access of people needing to go to hospitals and also those of the first responders getting to and from the hospital. So it's the access that is severely limited, and it's often dangerous to use these normal pathways. In Ukraine, as in most other of Halo's other programs, landmines, cluster munitions, and the other explosive remnants of war deny people access to critical infrastructure, which includes hospitals and therefore affects access to healthcare more widely. And you've mentioned it before, there are various news reports that outline the attacks specifically on hospitals and other healthcare infrastructure, and the long-lasting impact of that is undeniable. And I'm sure that obviously my fellow panelists can cover that in more depth than I can. But one additional point, and Fred, that's very much to your point on mental health, on medical support needed, which is often forgotten, is the need for psychosocial support and the burden of long-lasting insecurity this contamination brings with it is not to be underestimated, and it must be addressed alongside the physical clearance we engage in. So that's the overview of where we're at and how we're scaling up. Considering all of this, the questions obviously remain: what needs to be done to address these issues? And for that, I would really like to highlight 4 key points. Firstly, and I've mentioned it there, we see a growing concern over the direct link between explosive hazards and food security, both locally and internationally, as accidents involving tractors and other farming equipment have significantly increased. Secondly, and specifically addressing the medical needs here, the need for psychosocial support is huge. And thirdly, which is on a more of a technical note, mine action operators such as Halo need to gain permission to use explosives to clear found and identified items. So for that, we need legislative change, which is required, and we're raising that with the relevant Ukrainian authorities. And then lastly, the current extent of explosive contamination is not yet fully known, but is the largest in Europe since the Second World War. It will take many decades to clear, and therefore long-term structures, coordination, and funding for mine action will be critical in the years to come in order to address these levels, which we haven't seen before. I will stop here, and thank you very much for having me on the panel.
Well, thanks, Kim, and quite a sobering picture indeed with the data you're mentioning about the number of destroyed hospitals, attacks taking place, the wounded and the dead. So I am indeed, given your long-standing experience also in Afghanistan and other parts of the world, interested on how you work with the local authorities, because also there the disruption in infrastructure probably is impacting the way you work with local authorities. But I think we keep that one as well for the conversation. Because I would like to turn now to Marius. Marius Geantă, very happy to have you as well. You're the president and a co-founder of the Center for Innovation in Medicine. And I remember that we spoke to each other, I think, shortly after the start of the war, shortly after the 24th of February. And you are based in Romania, you're based in Bucharest. And I remember that very early on, you told me about the context that you had with the patient community in Romania, together then with the patient community in Ukraine. So I'm very interested to hear from your perspective how you indeed go about coordination and also working with the local authorities to ensure that patient populations get the medicines and the equipment they need. And I'm especially also interested indeed if you could tell more about the supply of medicines issues, because Oksana mentioned, of course, supply issues. And I think my question is the biggest problem to get medicines and equipment in the country, or is it really hard, given the destroyed infrastructure, to get medicines and equipment to patients. So the floor is yours, and looking forward to your contribution.
Thank you so much indeed, Elizabeth, for this very, very timely conversation and discussion. And why is very timely? Because currently the level of emotion at the society level actually related to the war in Ukraine is slightly decreasing. And this is very important because most of the decisions, most of the actions of the Western politicians and Eastern politicians were actually pushed by the reactions of the people, of the citizens, of the society. So in a way or another, we should keep this interest in terms of political decision. And you mentioned that this event is as well very timely because Ukraine, but as well Moldova, received a green line from the European Parliament, as well from the Council, the recommendation of the European Commission to become part of the EU. And let's not forget that this week NATO will join for a very important meeting in this context of the war in Ukraine. I start by saying all these things because it was something we knew from the beginning of the war. And from the beginning, we said that it's a war in Ukraine, but it's a crisis in Europe that will change everything. And now, 4 months after, if you have this helicopter view, it's very easy to see the changes in terms of geopolitics, in terms of different partnerships, and so on and so forth. Coming to your very concrete questions regarding the shortages of medicine, indeed, this was the main request as well for me and for our organization at the beginning of the war. And of course, I did my best trying to connect, and especially on the diabetes was a big request of insulin, and especially for children at the beginning. And I did my best with the pharma companies that produce insulin to provide enough insulin to the country. But seems like the issue was this disruption, internal disruption of the normal way the medicine are delivered to the patients in need. And yes, this seems like was and still is the main problem when it comes to access to medicine for the chronic diseases patients that are currently in Ukraine. On the other side, Romania was one of the countries with a big number of migrants. I have to say that currently, except Poland, actually most of the migrants are in the Western countries. So Romania was just like the country for them to like a transition country to other countries, but from the beginning was an instant reactivation of the civil society. There are a lot of NGOs, some of them with a long experience in this type of humanitarian aid. But the good things in this context of the war was the immediate action of the Romanian state, which for us living here and experiencing other crises was a surprise. But actually, with the war in Ukraine, the state mobilized in a matter of 2 or 3 days at the northern border, where currently is a base of the European Commission for humanitarian aid, as well for different materials and medicine and so on. And this is, I should say, this is it's a big thank for the Romanian state government and especially the president who was and still is highly involved in this. Another issue was, because was in place and still is, this temporary protective directive, how we can actually implement this. We'll be able to implement this in the health system, because we know that in the Central Eastern Europe is the case for Romania as well, for Ukraine, for Bulgaria and other countries. We know that these health systems are not so performant, are weak in terms of performance. I'll give you just one example. The mortality rate due to COVID is the highest in this part of Europe, is highest than anywhere in the world. So the performance is quite low, and this overlap of this low performance of the health system, of the pandemic, let's not forget this, the overlap of the war and the energy crisis. I think this create what you called, Elizabeth, in our discussion, in our previous discussion, actually the perma crisis. So we all actually ask ourselves, are we able with our hospitals, unreformed hospitals and unreformed the medical system in Romania, to provide the right medical care to the people from Ukraine they need? And the answer is yes, but wasn't easy. First of all, because we have to choose in our legislation back to 1961 to identify a law that allow us actually to provide free of charge medical care to the Ukrainian people. Actually, the law referred to the former Soviet Union citizens at that time. So this was a challenge. And another challenge was, the message, the official message was that anybody from who is a migrant from Ukraine and has an issue, a health issue, should go to the hospital and will immediately receive the medical care they need. And this is not always the case with the Romanian patients. And we're afraid not to see a divide, not to see like a stigma and between one and another. I have some anecdotic examples of doctors reacting to not so in favor of the Ukrainian patients, but it's something that was managed at the local level. So to conclude on the way Romanian state and government and president actually react to the Ukrainian crisis in terms of humanitarian and medical help, maybe we were discreet, but the help was a very concrete one. And I think the visit in Kiev of our president together with Draghi, with Scholz and Macron last week, right before the council, I think it's a really relevant one. And indeed, we enter a new era where Ukraine and Moldova should become part of the EU. And for these countries like Romania or Hungary or Bulgaria that are already part of the EU and part of the Central Eastern Europe with this historic background, cultural background, let's say maybe a different level of understanding of the local realities, should act like enablers for Ukraine and for Moldova people, citizens, institutions, to help them being faster and better integrated in the EU. And I will stop by saying that we've launched a call for the medical professionals and the young researchers at the beginning of the war, calling them to join us at the Center for Innovation in Medicine. And now I'm happy to see that few of them already join our team. We work together for some hopefully European project. Currently are proposals. Yes, it's even in the wartime, we should look a bit beyond to look to the science, because will be life after that. And I will end by I actually have no words to say to you, Oksana, for what you and your colleagues are doing on a daily basis in Ukraine.
Well, thanks, Marius, and really for pointing out how you're working with the Ukrainian patient community, and that you even had to invoke a law from the 60s to make that work. That I hadn't realized really. So it's very important indeed. And at some point you mentioned insulin when it came to shortage of medicines. In your experience, are there specific types of medicines like cancer medicines or other types of medication that are in dire need, or?
No, the main message, but I don't know if it's relevant for what is happening on a larger scale in Ukraine. But for me, the main messages were around diabetes and especially the lack of insulin. And just one more point, because you mentioned the cancer patients, some of them were under the cure when they come from Ukraine in Romania, and this was an issue for the local oncologists, because the clinical protocol is different in Ukraine than is in Romania, and they somehow should adapt based on very limited information regarding the disease, the previous treatments, and so on. This was indeed a challenge in terms of clinical practice.
Well, thanks, Marius. And I think you made a very important point, which is also the bridge to the next speaker, because you spoke about the importance indeed of keeping attention on Ukraine and calling for action, especially in a time where indeed there is now also a lot of political discussion about the accession of Ukraine to the European Union. And Marta, we're very happy to have you together with us today from Promote Ukraine. You're the founder of Promote Ukraine. And really, since the start of the war, you have been an NGO that has been very, very vocal to indeed raise the Ukrainian cause and everything that's needed indeed for communities in Ukraine, also patient communities. And in that respect, we're very keen to hear from you how you are following the situation on the ground and how you're working also with other NGOs on the ground.
Thank you, Elizabeth. Indeed, I started the organization 8 years ago, and already 8 years ago, there was a vast network of civil society organizations in Ukraine with whom we worked. We started our first charity projects, so humanitarian aid projects, back in 2014 when there was Euromaidan revolution to help those injured at Euromaidan. We were transferring funds to those foundations that helped them directly on the ground. Also, in 2015, we worked together with the rehabilitation center Jarelo. It had nothing to do directly with the war in Donbass or with Crimea, but we wanted to help those organizations and those centers that dealt directly with the people who needed medical help. And Rehabilitation Center for Youth Jarelo in Lviv was one of such centers. And you know, in the beginning of our conversation, you showed a video, and on the video there was Perahov Mobile Hospital. And I remembered, and actually I didn't plan to say that, but I just remembered that back in 2015 we organized a charitable auction, and one of the beneficiaries of our auction was actually Perahov Mobile Hospital, because this was the hospital that was on the ground in Donbass, helping people evacuating and also helping those injured on the field. Since the 24th February 2022, we are in direct touch with the hospitals in Ukraine, and we went together with the MP George Dalmagne. It's a Belgian MP who was director of Doctors Without Borders here in Belgium for many years. Now he is MP. We went together to Ukraine to visit Lviv to see the hospitals. We also visited military hospital, and we brought some medications. And then we also made some ties with those dealing with injured people on the ground. But our main activities are now helping foundations such as Patients of Ukraine raise funds so that they can help their patients or their members of their community, and Patients of Ukraine represent 1.5 million people in Ukraine, and Ministry of Health in Ukraine in direct communication with the Patients of Ukraine. If there is some important decision to be taken, they take it in the consultation with the Patients of Ukraine. Such a project that we made together with Patients of Ukraine and for them, for the benefit of this organization, was done on 14th of June. Now, like 2 weeks ago, it was charitable concert, and we managed to collect 11,000 euro to buy fixation. It's fixation bands for limbs. So 10 people will be treated thanks to that charitable concert, and we are very grateful to those people who donated and who came, and now we can spread the word and make probably more efforts to support Patients of Ukraine. Also, a very important project, and that the project we are dealing with from the beginning of the war, is Help Chernihiv. It was started by our volunteer, Igor Brzaty. He's a volunteer who works at Konrad Adenauer Stiftung, but he is volunteer at Promote Ukraine. You know, Promote Ukraine is charitable, but it's pro bono organization. We have mainly volunteers, so we have no people working actually as employees beside the help desk that has nothing to do with the humanitarian aid. So it's basically everything based on volunteers. So one of such volunteers is Igor Brzaty. He's himself from Chernihiv, and he has a vast network of activities, local authorities, businesses, and most importantly, clinics in the city and in the region. Additionally, Igor has connected with social initiative in Chernihiv called Living Health OA, who had volunteers on the ground and ready to channel the support. Through that project, Living Health OA, volunteers and network, Promote Ukraine is able to get in touch with hospitals and ask for their needs, get in touch with the city administration in rebase the medical needs, ensure that the medical supply procured in Ukraine or abroad is received in the city, and ensure that medical supply is delivered to the hospitals and people, so basically the patients. Concretely, Promote Ukraine was able to deliver to Chernihiv City Hospital and to Chernihiv Military Hospital and to Chernihiv Regional Clinic and to Chernihiv City Clinic the following medical supply: external fixation devices used with open fracture for doctors of in the regional clinics, sanitary devices for the hospital, sanitary and clinic wheelchairs, bandage, elastic fixations for legs, hands and arms, hard and soft neck fixations, and many other medical devices. So the medical support for Chernihiv totaled now 7,000 euro, all distributed in hands to either people or doctors. So making it very effective in terms of money and support ratio. Overall, Chernihiv is a depicting model of our work. Our volunteers are connected to the ground. They connect with local networks, associations, NGO, which operate and Promote Ukraine volunteers, while understanding local contacts, provide the reality check, ensure the support reaches the destination. Best support of citizens on the ground is through supporting various NGOs, networks, and initiatives. The strength of civil society is that it is decentralized and it has access to small communities. Thus, supporting various networks, associations, initiatives, focusing on concrete cause and concrete target groups is very effective and serves a very different purposes than systemic support of international NGOs, Ministry of Health, and so on. The civil society initiatives, networks deliver the support quicker, more targeted and usually with very effective funds targeting people directly in the region. And this is exactly the approach of Promote Ukraine. We also, like, independently from Chernihiv, independently from other organizations like Patients of Ukraine, we are also delivering first aid kits of NATO standards to the military directly, to the battalions, to make sure that they get the medical kits when the army, when the military are injured. So this is what Promote Ukraine is doing. We are raising funds constantly, and we are making sure that these funds are efficiently distributed.
Well, thanks, Marta, for your insight, because I think this is a really clear example of indeed how an NGO like Promote Ukraine is working. And also, I think, illustrating how strong Ukrainian civil society is with the way you work with indeed NGOs based in Ukraine. So I think that was very powerful. And I think it's also for me a question that I'm keen to raise. But let me perhaps first turn to the audience, because as I said in the beginning, I'm very keen also to get your input. Please raise your hand or feel free to speak up or put your questions in the chat. I'm looking at the chat, and perhaps my colleague Natalie can help me to see if I missed anything. I can't see any questions yet. I think I see no hands up either. So let me then perhaps start with questions, and I still need to call on any of you from the audience if you have questions to come in and join us for the conversation. But I want to pick up on the point that Marta made, because Marta, you made an important point about civil society organizations being rather decentralized and therefore able to reach communities. I can see why that is important, but if we link that back to the previous point we made about the need for coordination, because I think both Fred and Kim mentioned the importance of having a certain coordination, both I think between NGOs, but certainly also with the authorities or the health authorities. So I'm keen to get your input about how is that currently working and what can be done to improve coordination. So perhaps Fred, I think you raised the issue first. Feel free to come in.
Yeah, I mean, look, it's a struggle because there's so much activity. And, you know, we're trying to speak with the governments that are involved and encourage them to take the initiative in creating these coordination mechanisms. I'm speaking now specifically about the accountability. Right, I'm only talking about the justice mechanisms. I can't speak to humanitarian aid delivery, which is another matter in which there are, you know, existing structures in place. But on this front, you know, I would say we're making limited progress because the focus now is getting people deployed to Ukraine, getting the equipment and the resources that the general prosecutor needs, and everyone wants to be the first. So there's almost an accountability competition. And instead of people stopping for a moment to say, well, how can we do this best together? And I would just say, I think that especially Ukrainian civil society has a very important role to play here. And maybe that was one theme that, you know, we heard from all of the speakers to some degree, because, you know, they're on the ground, they're knowing the culture, the politics, the dynamics better than anyone, and can help to raise these issues, identify the issues, right, and possible solutions. So we're turning to them also for our guidance on how to move this forward.
Marius, I think you wanted to come in as well.
Yes, just a short comment on this role of NGOs and a better coordination. I just want to say that actually we, the civil society, we cannot replace the state. This is very clear. We can activate the state, we can activate the citizens, we can work together to activate other civil society organizations. This is on one side, is the way we can be proactive and to influence other organizations and people, and especially the state. On the other side, I think it's very important for the states to recognize the role of the civil society, who actually become more and more complex in the last years. We discuss about the humanitarian aid, about the helping patients, but as well we see some very good examples today in our webinar on different other ways to coming from the civil society to help the state actually, and in the areas where the state is not developed yet, is not maybe has no capacity yet. This is again a very important message. Of course, in Ukraine now, it's a slightly different situation because there is this message of coming from the government, and a joint message coming from the government and NGOs and citizens all together fighting, which is normal, is great what is happening. But in the other countries is not the case. And is still this divide between the state and civil society, who sometimes impact the way the actions of the civil society. And this is the reason in my intervention at the very beginning, I said this time the state act very, very fast, because usually we wait for weeks to see from the government a very concrete actions. I'll stop here.
Well, thanks, Marius. And Kim, I see you have your hand up. So is that something that you recognize, the very fast reaction and indeed the desire for coordination as well?
Yeah, I just really wanted to come in there. When I talked about coordination, I really meant within the mine action sector, and that's twofold. So we've got the coordination with the authorities and specifically the emergency service, the state emergency services, where I also mentioned the legal issues, where we're obviously as keen as possible to support and build capacity and include training. But then the second part of that coordination is also among the mine action operators. So as I mentioned, Halo is one of the operators who's been there prior to the 24th of February, and we've had our operations on the ground. There's obviously such a need to engage, that the need to coordinate among the operators is huge as well, because the last thing now we want is to duplicate efforts in areas where there's already coverage. So I think that's where the coordination needs to be twofold with the states, with the state and the authorities, but also among operators and other NGOs. And then just to point one point on partnering with local organizations, that's obviously something which is not only necessary in that context, but what we support as a sector more widely, to partner with local entities wherever possible to have the greatest possible community-based impact as well.
Well, thanks, Kim. And I think, Oksana, you wanted to come in because indeed you working on the field, I'm sure that you also have some suggestions on how perhaps coordination can be improved.
First of all, I wanted to thank everyone who spoke. And I have heard about their work, and I'm convinced that you're not forgetting Ukraine, you're not forgetting our people, you're not forgetting about this very complicated situation where we find ourselves. So thank you once again. But I also wanted to ask for your help. Today we are working with state bodies, and we work with non-state bodies, and there are a lot of needs. And I wanted to address all of you and all of our organizations that you represent. Would it be possible to express our needs to your organization in order to receive particular help? As we speak, we get a signal telling us to proceed to the bomb shelter. Unfortunately, there's nothing we can do about that. Several times a day, both day and night, we get these signals that encourage us to find the bomb shelter. Why did I start talking about this? Because ambulance vehicles have been destroyed, and they are a great need for us. I have a question whether your organization would be able to help us with ambulances. Would they be able to provide them so that we are able to evacuate our people to medical facilities, because we are working in a combat context. This help is not coming from anywhere. We don't have any rotation. We keep working around the clock. Thank you very much.
Well, thanks, Oksana. And I think the fact indeed that you have to go, we all fully understand. And I think it's another illustration of the sobering situation in Ukraine. So if you have to leave for security reasons, please do, of course, because we all understand that is of utmost importance now. And I think your question about indeed the importance of ambulances that are needed for evacuation, I think it's well noted. I'm sure that also, for example, Halo Trust, but also the local communities working in the CE countries try to pick that up. So I don't know whether any of the speakers would like to come back to that very specific demand. Because I think it's well noted, and also as a follow-up of this event, because the European Policy Center indeed intends to work on a broader project where we will work on the more specific impacts on healthcare systems and the needs at local level. So I think in that respect, your question and your demand is well noted, really. I see that we also have a question from one of the attendees. So Alina Pavel is asking, Marta, can you please repeat the name of the Belgian MP, I have to say, who was involved with Promote Ukraine? And then Alina makes the point about the fact that Ukrainian refugees are waiting a long time in Belgium to access the health system. They've having to live for months in centers designed for them to stay for days only. Before they are added to the system through the Temporary Protection Directive, they only have access to healthcare via calling an ambulance, which is very inefficient. So indeed, I think this is the point about healthcare being, I think, delivered in terms of emergency care, whereas of course, more direct access to medical services and to healthcare would of course be much more preferable. So Marta, I think the question first is very practical, the name of the Belgian MEP, and then any input, because of course we are now speaking about a humanitarian situation in Ukraine, but indeed the impact on healthcare systems in Europe and the access from Ukrainians to healthcare system is a very important point that requires almost a separate debate. So any comments there, feel free to share them with us.
Sure. Belgian MP is Georges Dalmagne. He's from CDH. He was director of the Doctors Without Borders. And I went with him and with Belgian, another MEP, Benoit Ludgen. So it was MEP and MP. We went back in March. I think it was 2nd or 3rd of March. It was just 1 week into the full-scale war. As for the healthcare for Ukrainian refugees in Belgium, I need to say that there are several hospitals where Ukrainians can go and get the medical help if they need it. So even if they are without papers, they have the proof that they are Ukrainians, they have Ukrainian residents. The paper from the FedAsyl, I think that the paper from FedAsyl they can get almost immediately. When they arrive, there is an electronic queue, so they stay in this electronic queue, but it doesn't take long. And when they have that paper, I think it's Annex 15, if I'm not mistaken. With that paper, they can go to certain hospitals in Brussels and get medical help. But of course, the mutuality which they get, for that they have to be registered in the municipality. So they have to have proper papers to have mutuality.
And in terms of let's say access to information, because I can imagine that language-wise, finding the right information about healthcare systems or healthcare centers or hospitals is not always easy. Do you see problems there? I mean, are communities or municipalities able to reach patients and citizens that they need to reach?
Some municipalities do make efforts to give information to Ukrainian refugees, even in Ukrainian. There are also some services from Belgian government that serve Ukrainians in Ukrainian language, but I don't know to what extent the information is available. I'm not sure of that, but we promote Ukraine. We have a help desk where Ukrainians can call and ask questions about the healthcare, and we would answer their questions. So we have a team of employees who work at help desk, and this is actually their job to answer the question of Ukrainian refugees, so specifically also on healthcare system. We work with Partenamut on that. It's a Belgian the medical security company, and with them we get more information ourselves, so we can pass it to Ukrainians.
Oh, that's really good to hear, because indeed in Belgium they are important. There are important providers for healthcare information. So that's really good to hear. And if you want, we're very happy, of course, to also highlight via social media that indeed you have these people working for you. I think Marius, you had your hand up as well.
Yes, I would like just to comment, because you raised this issue of health system impact of the war in Ukraine, and maybe I will link this with the need for coordination, maybe from the EU institutions level, saying that actually we are somehow lucky, because the health was a priority before the war for the European Commission, for cancer, for other NCDs, of course, for COVID, and so on. We have this partnership for health system transformation already in place. But my point on this is that we should actually, and this is actually our point of view, that we should advocate for prioritizing this region with Ukraine, with Moldova, with other Eastern European countries in the current frame of the European programs like Horizon Europe. We know this discussion around excellence, but I think we can prioritize the region as well for youth, for health, for digital Europe. Before the war, we discussed about how to best digitalize the health systems as well in Ukraine. So I have seen the last call, and I will give you just one example and I will stop it. I have seen the last calls on cancer mission, and some of them actually said that the people from the commission will prioritize project related to children cancer. Why not having the same approach, recognizing this problem created by the war in Ukraine, and prioritizing from the beginning actually the allocation of the funding, of course with the involvement of the well-recognized centers, depends on the area from other European countries.
Well, that is a very good point, Marius, and I think you spoke about the timeliness of this debate. I think it's important, especially after last week's candidate status to Ukraine, that indeed there is also now the likelihood and I think the opportunity for Ukraine to become part of some EU programs that are already including candidate countries. And especially given the importance of health, and I think the focus on health, especially since the pandemic, where we all realized the importance of investing in health systems. And of course, the war makes it even broader and makes, of course, that needs are seen in a very different context. But I think in general, indeed, the funds that you mentioned, I think are now also important to look at from that indeed larger perspective and from the neighborhood countries perspective as well. I think we have a few minutes left. And again, a lot of the issues that we raise really almost require a separate debate, because I remember that we also mentioned at some point mental health, sexual violence. I mean, these are very delicate topics. And again, it all comes with investing in the health infrastructure, because especially the scale of people affected and impacted by mental health problem is enormous, both in Ukraine as well as, of course, the people that have to flee Ukraine and come to Europe. So Fred, I remember that you mentioned it, and again, I'm aware of times, but in terms of the takeaways of today's discussion, and also to see what we can do next when we are going to work on a broader program as the European Policy Center. What is your main takeaway that we need to do when we speak about mental health, and what can be done more?
Well, yeah, I mean, I'm certainly, no expert in psychosocial support, and defer fully to my colleagues. I mean, the one angle I have on it is to consider mental health as a casualty of war. And so when we talk about the impact on civilians and how they get hurt physically, we have to include how they get hurt psychologically. And, this is not clearly defined in the laws of war, but it should be part of our calculations. And that has a filter on effect when we view it through that way. It's another measure of the impact that the conflict has on civilians. And it can factor in more prominently to the humanitarian response. I mean, I know there is a movement for this. This is nothing new within the humanitarian sector, but we should keep reminding ourselves of its importance. Of course, the mental trauma has physical implications down the line. It can affect people physically. It can lead to domestic violence, or child abuse and other forms of physical harm that we can see years after the conflict. So I think from our perspective, it's a reminder that that this is one of the tolls that civilians are suffering, here and in conflicts around the world.
Absolutely. I see we have a question from Irene Tsutsino. Irene, would you like to speak up or put your question in the chat?
I will be happy to speak up. I'm not sure if I'm unmuted. Can you hear me?
Yes, I hear you well.
Thank you. Thank you. So I'm representing the Blue Heron Foundation. I'm the medical director for the Blue Heron Foundation. We operate out of Romania, Moldova, and also bringing medication to hospitals in Ukraine. And I had two comments. First is that we continue to have problems with the steady flow of cancer medications. We have a program for cancer patients, displaced cancer patients. And originally we had seen 200 patients in Moldova register for cancer care. We are moving some of these patients for care in Romania. And again, I want to emphasize the absolutely wonderful job that the Romanian government has done on response, as Marius was saying. But the flow or steady flow of cancer medication, both to Moldova and within Ukraine, is not happening yet. And I realized that the pharma companies have done a wonderful job providing tons of medication, but usually it is to global agencies. And that has the problem that I believe is Marta or Kim had alluded, which is the local distribution. We, the NGOs and the civil societies, are much better positioned to deliver the medication to the places where we know is needed and the type of medication that is needed. So my call for, if there are any pharmacists here, is to encourage them to work with us, the focal NGOs, so that we are much more efficient and faster delivering this medication where it's needed. We work with the Oncology Institute in Chisinau and with the Bukovina Cancer Center, for an example, and we are continuously receiving lists of cancer medication that is needed. And so much of it is beyond the budget of any civil organization. So encouragement to that. And the second one, Marius has alluded, we need to figure out how we strengthen our collaboration with the government, because these patients are moving continuously from one place to another, and we are losing them. We are not able to provide steady care because there is no registry that allows us to continue to find these patients. Neither when they come in at the border, there is no questions asked about medical conditions that get passed on to us, the medical organizations. So it's very hard to provide steady care. So thank you for this forum really has addressed very important issues. Just wanted to highlight the medication supply, steady supply, and the ability to track patients so that we continue to deliver care. Thank you again.
Well, thanks so much to you, Irene. I think indeed you added to the list of takeaways of today's event. I think indeed with your last 2 points about supply of medication and also cancer registries. I know that Marius had to leave, but I'm very happy to touch base with him afterwards to also see indeed how we can work further with him to bring this forward. So that really brings me at the end of, I think, a very rich, but at the same time sobering conversation. I think, again, we started by saying that despite, let's say, the positive mood last week here in Brussels when it came to the status of Ukraine and the candidate status that Ukraine got, the humanitarian crisis is ongoing, and we saw a lot of examples from that. So I really would like to thank all our speakers, Fred, Kim, Marta, Marius. I will thank him afterwards as well. And I think mostly Oksana, I think we're all very humbled that you made time speaking from the ground to tell us about the atrocities that are happening, but also about the incredible efforts that you and your colleagues do to help citizens, to help patients. So again, we are with you in our thoughts. I think from a professional perspective, we will ensure that indeed we keep focusing what needs to be done more, both from an EU, but also from a US perspective. And also your call from your ambulances, I think also privately when we donate money, let's keep that call in mind and let's indeed donate money to causes that Oksana has mentioned, because they are much needed and still very much needed. So many thanks to our speakers. I really do hope that this is the start of a continuous conversation, because as I said, at the European Policy Center, we will start a broader project to work on the policy implications as well of the Ukraine debate and the humanitarian situation included. So I hope to stay in touch. I invite you to get our newsletter so that you hear about upcoming events and publications. And I wish you a good rest of the day, and many, many thanks again for being with us today.